actually thought about death a lot the first year after my accident, and I didn't know why. I was actually scared of dying all the time. But I've figured out now that maybe it's just because my life changed so quickly, so fast when I've gone from working full-time to, you know, going out every weekend and just being normal to my whole life now. Like, I can't work, I can't do anything at all. So I don't know if that had something to do with it, but I thought that life can change that quick, that we're not that safe as what we think we are.
The trauma itself is defined as an experience of actual or threatened death, actual or threatened serious injury or sexual violation. Particular triggering incidences can involve having that direct experience of the trauma yourself or witnessing it, such as what is evidenced when, you know, by bystanders or first responders to accidents or emergencies or police officers. So, but it can also be about learning that an accident or a violent incident has occurred to a loved one, so a close family member or friend. The cluster of symptoms can include re-experiencing symptoms, arousal symptoms, negative mood and cognitions, and avoidance symptoms. So re-experiencing symptoms refers to the fact that some people will experience flashbacks or repeated intrusive memories of a trauma, nightmares. Arousal symptoms is about overactivation of a system following a traumatic event, so that may include hypervigilance, exaggerated startle response, sleep disturbance, a whole range of symptoms where people feel more aroused. Negative mood and cognitions is where people start to experience feelings, uncomfortable feelings, perhaps disconnection from other people, disconnection from their future. They may have a lot of thoughts about blaming oneself or other people around the trauma. Avoidance refers to people's tendency to try and avoid those internal processes because they're distressing, and also to avoid external stimuli that may remind them of the traumatic incident.
I was sexually assaulted as a teenager. I was stalked, and the incidents that were involved in the stalking, my family didn't believe were happening, so that I was eventually sexually assaulted. And because I felt I was protecting family members, I didn't report the assault. That was almost 40 years ago.
It's interesting. I'm not a clinical psychologist or a psychiatrist, so it's slightly outside my area. But what I do know is that there's more and more evidence that psychological trauma, whatever form that takes, comes back to neuroplasticity. We know that there are changes in the brain in terms of how we react to things. There are sort of conditions such as hypervigilance, where our nervous system reacts more strongly, we're more aware of things. That's the sort of psychological situation, but we know that that psychological situation, which can happen in response to trauma, changes the way that our pathways work in our brain. So there are brain centres that link down to the spinal cord, that control the amount of pain that we experience, the amount of information coming through. We know that psychological trauma changes the way that that system works so that the body is basically more responsive. So somebody who has been through that, we know that the brain and their spinal cord is working differently, that more messages are getting through and pain is stronger. So I think that's what we're learning, is that now that there's this strong link between what we've known for a long time in terms of psychology and psychiatry and what we've known for a long time in terms of physiology. But the exciting thing, I think, is that we're starting to see these links come together with brain imaging, which is a fantastic technique. We're starting to see what's happening in the brain and to realise that these psychological processes are triggering these physiological processes which change the way that we experience pain.
My current situation, that I was diagnosed with lupus about 5 or 6 years ago. I'd had symptoms for a long time that weren't explained. So the lupus diagnosis made a lot of sense to me and explained a range of different symptoms. Trauma causes the final compromise of the immune system, that makes the immune system malfunction and the body attack its own cells. I'd certainly understand that that stress affects my lupus and my pain levels.
I think the change in my thinking has been a realisation that many of the patients that we see with chronic pain have associated symptoms which coincide with those that we would expect to see in sick or injured animals. And these include fatigue, problems with sleep, problems with memory, problems with thinking, all come under the label of a stress or sickness response. And in the program that we run at Fremantle Hospital, those people who are referred to us complete quite detailed questionnaires. And these symptoms come together very frequently. So I think we're seeing in traumatised people a stress response system activation that hasn't been able to switch itself off when the particular stressor is no longer present.
We do get quite a few people in our online pain management course, the pain course, who do or have experienced a significant trauma. Sometimes the trauma is what has led to their chronic pain. Sometimes it's a trauma that's occurred before they've had pain. It is common, the research does suggest that there is a greater number, a lot of people with chronic pain have had a trauma. Experiencing a trauma or very high levels of stress, which of course you're going to do when you're having a trauma at the time of an injury, seems to be part of what's going on chemically in terms of sensitizing the nervous system. The challenge of treating people with PTSD and trauma and getting a really good sense of their experience is that the actual act of talking about their trauma is very difficult and can lead to a whole heap of distressing symptoms, flashbacks. So it is very difficult. It's difficult to treat. There are effective treatments, but they're hard work, and it's important to get someone who's experienced in treating them. And it's an important part of managing pain.
I went through a phase where I just like doing things like going to get my hair done and stuff is things that I've always enjoyed. And I'd get to the point where my hair was just a disgrace because my back was so sore I couldn't do anything, but doing that kind of thing cheered me up. And I would just cry when I'd wake up in the morning.
For a start, there seems to be an increased prevalence of people experiencing post-traumatic stress disorder who also have a chronic pain condition in comparison to the prevalence of in the general population of people experiencing post-traumatic stress disorder. It may very well be the case that experiencing post-traumatic stress disorder makes it more difficult to manage a chronic pain condition, both because post-traumatic stress disorder is so impairing on its own to experience, let alone also managing a chronic pain condition. But the post-traumatic stress disorder, may be exacerbated or complicated by people's experience of pain, where the pain reminds them of the psychological trauma, thereby exacerbating the post-traumatic stress disorder. So it can work there can be a connection